I'm not an expert, and you are. My understanding is they'll put everybody on the waiting list, and then they do prioritize based on a set of criteria that has been agreed upon through some national organizations, not government mandates, but kind of the medical provider community and the community that actually does the transplants, and the organ groups that try to encourage people to donate their organs. They agree on the protocol for who goes to the top of the list. Isn't that correct?
Yes.
So they do.
My major concern is the major lobbying groups that we have in this country that dictate to you. I mean, we can get to you today because you're here, but there's no way that me, as a private individual, could go to Washington and say, I need to talk to you guys and let you know what reality is, because a lot of senators and representatives will make it, state, oh no, you can't do that unless you have like a lobbying thing behind you.
Well, you'd be surprised. Most members of Congress, if you make it to Washington, will find time to see you if you're a constituent. And it may only be for 5 minutes, and it may be in the hallway going to committee. But I think this is a 99.9%. If I know a constituent is in the office and I'm in the office, I'll go out and say hello and see what their issue is, if they're constituent. I see almost every constituent. I probably see 1 out of 10 so-called lobbyists that want to see me. Now, they'll see somebody in my office. They'll see one of my staff or something. But people who vote for me, I think, have a right to, because it's not my office, it's their office. And I'll let them sit at my desk and make phone calls and drink my Dr. Pepper, and, because they're paying for it.
I would like you to consider one thing, please. Well, I don't want the government to take care of me, and I work every day, and I pull my fair share. I would like some sort of consideration that the private entities will not be allowed to take everything I have.
Let me make a comment generically on what you said. First of all, you're one of the exceptional cases. Luckily, not everybody needs to have some sort of an organ donation. You did, and you got one, and we're glad you're here, and I'm sure your students that you teach are glad you're here. You can set up a national pool that people that don't have health insurance where they work or can't afford it can opt into, and we can cover all pre-existing conditions. We can provide vouchers for people of moderate income. We can provide refundable tax credit if you have a job. We can require that pool provide some sort of a catastrophic coverage for cases like you're talking about. And we can do that for a lot less and a lot less invasiveness than this. And I offered an amendment to do just what I just said in committee, and it failed because I struck all the mandates, and I put that voluntary pool with the refundable tax credit, the voucher, but it did cover pre-existing conditions. It was open to everybody in America. So I'm not opposed to some help to those people that don't have the financial means to help themselves. But we don't need to do this, in my opinion, to get where you think we need to go. This gentleman here in the polo shirt.
Chris Rosso, Southwest Arlington. First of all, I've been a practicing emergency physician here in the area for about 18 years. So
Well, great.
I've lived on both sides of this fence.
Why don't you come forward so that people can see you as opposed to just hearing you?
Anyway, so certainly I sit on both sides of this fence. I have it from the consumer perspective, just like everybody here, and certainly I have it from the provider perspective. And I have to say, I totally agree with the congressman, and certainly most.
Could you say that again? He said he totally agreed with me, for those of you out in the hall. Okay.
And the conservatives that are very hesitant to pass this type of plan. I have to make a couple of comments. In general, I would say that I feel like the regular working doctors have been really left out of this process. Now, maybe behind closed doors. Maybe behind closed doors, they've actually been involved in the process, but I can tell you that when you watch TV and you see Rahm Emanuel's brother, and you watch Howard Dean, and you watch President Obama's private physician, they do not represent the attitudes of most of your private physicians, I can tell you that. And certainly the AMA definitely does not represent our opinions. And they've been hijacked by a very small percentage of the liberals, actually, that tend to agree with this type of plan. So what I'd like to see, if there was some way to get regular working docs, these are in-hospital docs like myself, the emergency physicians, pathologists, your radiologists, the anesthesiologists, your private physicians, your family doctor, your internist, the surgeon, get them back at the table and explain to the congressmen, who are engineers and lawyers, mostly lawyers, obviously.
I'm an engineer now. I don't.
Doing fine.
I'm even registered professional engineer.
I think that's really a big part of this puzzle, I think, and it's so confusing. Let me tell you, this is confusing for the doctors when we listen to this stuff, and we practice this stuff every day, and we deal with this stuff every day. I can imagine how ridiculous it is from a public standpoint. Not that they're stupid people.
So do you have a question for me or a comment? I don't want to cut you off, but we got a lot of people, and you're supposed to talk for 2 minutes.
I think the one thing we certainly like to see is malpractice reform.
I'm for it.
And that has to be good. I know you've already told us what you want to strike out of these plans, but what are the things that specifically you would put into your plan?
Okay, good question. First of all, let me make a comment on what you said. You get a group of 10 or 15 doctors together, give us a week, maybe a month notice, and I'll come sit down with you. You get them together at a time that I can be in Texas, which is usually Friday, Saturday, Sunday, and Monday, and I prefer it to be on a Friday or a Monday rather than a Sunday. And we'll come over and sit down and have some sandwiches and potato chips and listen. And so I'll be happy to do that, number one. Number two, what do I support? There are some things in this bill, believe it or not, that are good. I should say a few good things about it, although most of it's bad. We got an amendment passed by myself and Anna Eshoo that puts in a follow-on biologics protocol for all the new biosimilar drugs that are coming onto the marketplace to give encouragement to the companies that are researching them so that we can get the best available drug therapies out into the population as quickly as possible. That's an amendment that she and I sponsored, and it passed 47 or something to 5. I mean, that is a good part of the bill. I do support a provision for a national voluntary pool to cover pre-existing conditions, and people can opt into if they don't have insurance in the workplace or they can't afford it themselves individually. I do think that we ought to ditch the SGR system for physician reimbursement, and I think we ought to reform the system, the DRG payment system for hospitals and clinics. It doesn't do any good to have a great system if doctors don't take Medicare and Medicaid patients. And under existing law right now, physicians are going to take a 21% cut in their reimbursement for every Medicare patient that they see this year. And it's expensive to fix that problem. It's probably a $20 billion a year fix, maybe less. If we combine it with some transparency and some incentives for increased efficiencies and outcomes, it may be less than that. But I do support a change in the SGR system. The one big thing that's not in the current law or this package that I strongly support is the concept of transparency. Now that seems simple, but you think about it. If you want to buy a car, there's all kinds of information easily accessible about makes and models and prices and service warranties. If you want to buy a house, if you want to go to the grocery store and buy milk or potatoes, you want to go buy some new clothes, And almost everything in our economy that is available for sale that is discretionary